Abby, and this is my head to toe assessment video. I'll start by showing the room to show that I have no notes, no papers. I'm using the books to prop up my laptop. So before entering the patient's room, I would check the patient's chart and check for a physician's order for a head to toe assessment. Upon entering the room, I would perform hand hygiene, provide for privacy, which I've done by closing the door. Introduce myself. My name's Abby. I'll be your student nurse today. Can you verify your name and date of birth?
Garrett Lobdell, February 6, 1993.
And can I see your wristband? Okay, just to confirm that information. So it looks like you're here for a head to toe assessment. Does that sound right?
Yep.
And are you experiencing any pain today?
Nope.
Okay, he is not experiencing pain. If he was, I would assess further using PQRST. Throughout the video, I'll be assessing the patient's skin condition, color, integrity for any lesions, and also temperature. For now, I'll test skin turgor by pinching the subclavicular area. Okay, the skin snapped back into place very quickly, meaning he's well hydrated and has good turgor. Just looking at him overall, his skin color appears appropriate for his ethnicity. It looks like it has pink undertones and is healthy. There's no visible bruises or lesions on his arms, leg, or face and neck. And feeling him, temperature is warm. And the skin is dry. Okay, I'll start with the neurological assessment. Looking at the patient, his posture is erect but relaxed. He doesn't appear to have any involuntary body movements or tics. He appears well groomed and is dressed appropriately for the situation. His level of consciousness, he is alert. And his facial expression is relaxed. Mood and affect are appropriate for the situation. And for what he said so far, his speech doesn't appear garbled or sound garbled. It's easy to understand, which if at any time during the assessment that changed, I would make sure to document that. So you were able to tell me your full name. Do you know what year it is?
2018.
And do you know where you are?
At home.
Okay. The patient's orientation is alert and orient times 3. His thought process so far appears is logical. Again, if at any point during the assessment that changed, I would document. And then on the Glasgow scale, I would rate him a 15 as fully alert. To start my assessment, starting with the head and face. Again, the color of his facial skin is appropriate for his ethnicity, healthy looking without lesions. His hair appears healthy and evenly distributed throughout the scalp, as is the color. His head is symmetrical, normocephalic, appropriate size for his body. Can you raise your eyebrows and puff your cheeks and smile? Facial features are symmetrical, meaning cranial nerve 7 is intact. So I'll palpate the scalps. During an actual assessment in a healthcare facility, I would be wearing gloves just in case he had any open lesions or wounds or lice in the scalp. Tell me if you feel any tenderness. Feel any tenderness?
Nope.
Okay. No tenderness. I didn't feel any bulges or masses and no lesions. I There doesn't appear to be any lice or dandruff, and the hair texture is thick and healthy feeling. I'm going to move to palpate the temporal artery. The temporal artery was 2 plus equal bilaterally. Next, I'm going to palpate the frontal and maxillary sinuses. Let me know if you feel any tenderness or pain. The frontal sinuses and the maxillary. Do you feel any pain?
Nope.
Okay, no pain in the sinuses. I'm going to palpate the TMJ. Can you open your jaw, move it side to side? Okay. There were no, did you feel any tenderness?
Nope.
I didn't feel any clicks. He was able to open it and move it symmetrically on both sides. So that is the motor portion of cranial nerve 5. I want you to close your eyes. I'm going to touch a place on your face. I just want you to tell me where I'm touching.
Nose. Forehead. Right cheek.
Okay, you can open your eyes. That is, so patient was able to tell me where I touched on his face, meaning he has normal facial sensation, meaning the sensory portion of cranial nerve 5 is intact. Next, I'm going to, just while I'm touching on his face, just to get it all out of the way, I'm going to palpate his 10 lymph nodes in the head and neck, starting with the preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical. Can you lean your head to one side? Deep cervical, just getting in there under the muscle. And to the other side. Deep cervical again. Posterior cervical. And then supraclavicular. Okay, did you feel any tenderness at all? So no tenderness, and I didn't actually feel any of the lymph nodes, which would be considered a normal finding. If I could feel them, I'd want them to be soft and mobile, not hard and stuck in place. Okay, moving on to the eyes. I do see that you wear glasses. Do you see an ophthalmologist regularly?
Mm-hmm.
Yearly?
Yes.
Okay, and so you use the Snellen chart when you go to the doctor's office where they make you read the letters. Okay, so I won't worry too much about using the Snellen chart unless the physician's orders called for testing visual acuity. So I'm going to have you remove your glasses. And by the way, that would be cranial nerve 2 intact. Okay, just looking at the eyes, the eyebrows and eyelashes, the hair is evenly distributed. There's no redness around the eyes, no flaking. It's not overly vascular on the eyelids. His sclera appear pink. The cornea are clear with no opacities, and the conjunctiva are pink and moist. And next, I'll check for perla. Again, looking at the eyes, the pupils do appear round and equal bilaterally, and they are measuring around 3 millimeters right now. I'm going to check for reactivity to light, both directly and consensually. Why don't you just look straight? Okay. Give you a break. Okay. Okay. So both pupils were reactive to direct and consensual light. Next, I'm going to have you look at my pen light out here and follow it in. Okay, and both pupils were reactive to accommodation. Next to check cranial nerves 3, 4, and 6, I'm going to have the patient look in the 6 cardinal directions. So I want you to look at my pen light, follow it without moving your head. Okay, patient was able to follow the pen light. There wasn't any jerky movement of the eyes, and they both followed equally, meaning cranial nerves 3, 4, and 6 are intact. Now moving on to the ears. Again, looking at them, they do appear symmetrical, appropriate size for his head. They are in line with the lateral canthus of both eyes. The skin appears pink and healthy. It matches the face, the facial skin. I don't see any lesions, no masses or anything, nothing bulging out of the ears. I'm going to push and pull on your ears. I just want you to tell me if you feel any tenderness. I'm going to start by pushing on the tragus, pulling on the pinna, and pushing the mastoid process. Do you feel any tenderness?
Nope.
Okay, no tenderness. And now I'll inspect the auditory canal. Okay. I didn't see any foreign objects, no drainage. There isn't any excessive cerumen or hair. Do you have any hearing problems?
Nope.
Okay. You never had surgery on your ears or anything, right?
Nope.
Okay, and next I'll perform the whisper test to check for cranial nerve 8. I'm gonna have you close your eyes. Instead of whispering, I'm just gonna make a sound on one side of your head. I want you to tell me if you hear it and which side it's on.
Left side. Right side.
Okay. So cranial nerve 8 is intact. The patient could tell me which side I was making the sound on. Next, I'll move on to the nose. Have you ever broken your nose?
No.
You didn't have any like issues with nosebleeds?
Nope.
It's not stuffed or anything right now?
Nope.
Okay. So the nose does appear midline from the outside. Both nostrils appear symmetrical. Again, the skin matches the rest of the face. I don't see any lesions, no masses. To check for patency, I'll have you hold one nostril closed and breathe in and out. And do the other side. Okay, both nostrils appeared patent. Now I'll inspect the inner vestibule of the nostrils. Okay. So I didn't see any lesions or masses on the inside either. The septum did appear midline without any deviations to either side. The nasal mucosa appeared pink and moist, and there was no excess hair or mucus. Do you have any problems smelling or
No.
anything like that? So that would be cranial nerve 1. Next, I'll check, inspect the mouth. So the pinks appear, the lips appear pink and moist. There isn't any drying or cracking of the lips. There's no lesions around the lips. Go ahead and stick out your tongue and move it side to side. Okay, so the tongue is midline. Can you say light, tight, dynamite?
Light, tight, dynamite.
Okay, and that tests cranial nerve 12, so that's intact. Next, I'll have you open your mouth and I'll inspect the teeth and the mucosa of the mouth. So the tongue is pink and moist, no swelling or anything, no lesions. Go ahead and stick your tongue out. The teeth appear intact, no obvious dental caries. The buccal mucosa is pink and moist. The pharyngeal wall, hard and soft palates, and uvula are pink and moist as well. Can you say ah? The uvula and the soft palate did rise. And can you swallow? Swallow with your mouth closed. Okay. You don't have any problems swallowing normally. Okay. And have you ever had any dental work?
Nope.
No dental work. Okay.
Aside from wisdom teeth getting taken out.
Okay. When was that?
Like 4 years ago.
Did you have any complications?
Nope.
Do you have braces at all?
Yeah.
Okay. And when was that?
When I was 12.
How long did you have them for?
2 years.
And did you continue wearing your retainer?
Nope.
Okay. Do you see your dentist every 6 months?
Yep.
Okay. And I'm gonna look one more time in there. Say ah again.
Ah.
Stick out your tongue. Okay. I was just inspecting the tonsils. I would rate them at a +1. They aren't swollen at all. I can't really see them. They're tucked into the back of the mouth. Okay. So next I'll move down to the neck. And I'll start by just inspecting it. It does look symmetrical. When he swallowed, the trachea looked midline. It didn't deviate to either side. He doesn't appear to have any obvious goiter. Do you have any problems with, or have you ever had any history of thyroid problems?
Nope.
Do you have a family history of thyroid problems?
Nope.
Nothing like that. Do you have any problems with your throat at all?
Nope.
No surgeries there?
Nope.
Okay. So since he doesn't have any history of thyroid problems, no family history of thyroid problems, and there's no obvious swelling or anything, I wouldn't worry about palpating the thyroid gland unless obviously it was specifically ordered by the physician, just because it is an invasive palpation. And the skin, again, does appear appropriate for ethnicity, pink undertones, healthy looking, with no lesions, no sores, or anything like that. So I'm going to next palpate the carotid arteries, starting on one side, only doing one side at a time. Okay, and it was 2 + equal bilaterally. And next I'm going to listen to the carotid artery, 3 spots on each side to assess for bruits using the bell of my stethoscope. Okay, so what I'm going to have you do is take a deep breath in, breathe out, and then hold it. You can take a breath. We're going to do the same thing on the other side. Okay, I didn't hear any bruits in the carotid arteries. I think that's it for the neck. Before I go any further, I'm going to go back through the 12 cranial nerves just to make sure I didn't miss anything. So he confirmed that he's able to smell. That's cranial nerve 1. He sees his ophthalmologist yearly and uses a Snellen chart to test visual acuity at his eye doctor appointments. That's cranial nerve 2. 3, 4, and 6, he was able to look in the 6 cardinal directions easily. Cranial nerve 5, we tested by palpating the TMJ, moving it up and down, moving the jaw up and down, and also facial sensation. Cranial nerve 7, we tested by looking at the symmetry of his facial features. Cranial nerve 8, we tested by performing a whisper test. 9 and 10, he said, his uvula and soft palate rose and he was able to swallow without any problems. This is what I forgot. So cranial nerve 11, I'm going to have you shrug your shoulders against my face. Okay, so cranial nerve 11 is intact. And then cranial nerve 12, he was able to say light, tight, dynamite. And just one more, or a couple more things for the neck. I'll have you do a little bit of range of motion. Can you tilt your head forward, back, side to side? Can you do like a circle? Okay. Do you feel any pain or tenderness?
Nope.
And you didn't appear to have any limitations with any of those range of motion tests. And then to test his head and neck strength, I'll have you turn your head against my hand as hard as you can. Okay. And the other side. Go ahead. Okay. So the patient's head and neck strength was equal bilaterally, the strength on both sides. Okay. So now we're ready to move down to the body portion. I'm going to start with the anterior chest. Are you comfortable raising your shirt up? Okay. So assessing for any kind of respiratory distress, the patient's facial expression is relaxed, calm. He doesn't have any signs of panic at all. I don't know any use of accessory muscles for breathing. Looking at or finding the 5th intercostal space by going down to the angle of Louis, over to 2nd intercostal space, 3rd, 4th, 5th, mid-clavicular line, where his apical pulse would be. The PMI, I don't know any heaves or lifts, which is normal. Again, the skin color is appropriate for his ethnicity with pink undertones. It appears healthy and supple. I don't see any lesions, any masses, and no freckles or anything, no moles. The hair is evenly distributed, and it doesn't appear to be an overgrowth of hair. Testing for temperature. The skin is warm and dry. And again, I didn't feel any masses or anything. So I'm going to start by mapping out my lung field. So it would start just a couple inches above the clavicle down to the 5th intercostal space in the front and the 6th intercostal space on the side. So I'm going to start with percussion. You hold that up like that. And let me know if you feel any pain at all. Okay. So the sound upon percussion was resident. I didn't hear any dullness where there shouldn't be. Next, I will percuss over the lung field in the same, or oscillate over the lung field in the same places that I had percussed with the diaphragm of my stethoscope. Every time I touch you with this, I'd like you to take a deep breath. Let me know if you start to feel lightheaded. Couple more. Okay. Alrighty, so I didn't hear any adventitious sounds. All the sounds were clear. There was no wheezing or bronchi. And lastly, for the anterior chest, I'm going to listen to man in all the areas to listen to the heart. Again, using the bell of my stethoscope. So the aortic area is going to be in the second intercostal space, right sternal border, which I'll find by again finding the angle of Louis and going across to the right side. This is the aortic area, and then across to the left side, the second intercostal space, left sternal border for the pulmonic area. Down to the third intercostal space for Erb's point. And that was left sternal border. Fifth intercostal space. Left sternal border. This is the tricuspid area. And then moving over, again on the left side, fifth intercostal space to the midclavicular line for the mitral area. Okay. The heart sounds were very strong. They had a nice rhythm to them. I heard S1 and S2 with no additional sounds, no whooshing sounds, nothing that I would consider abnormal. Okay. So that would be that. You put your shirt down. Do you have any history of cardiac problems?
No.
Any history of pulmonary issues?
No.
So you don't get bronchitis or any kind of, never had pneumonia?
No.
Nothing like that? Okay. And do you ever have problems breathing, or do you feel like you have to cough?
No.
Nothing like that? Okay. Do you ever feel like you have a racing heartbeat? No. Or like a bounding heartbeat? Okay. And do you have any family history of cardiac or pulmonary issues?
No.
Okay. So now I'm going to have you turn around on the bed. And I'll inspect the posterior chest. I'm going to lift up your shirt. Okay, looking at the posterior chest, again, the skin is appropriate for ethnicity. I don't see any lesions. No raised moles. The skin appears intact. Feeling the temperature with the dorsal side of my hands. The skin is warm and dry. And it does appear symmetrical. First, I'm going to check the AP diameter by taking a rough measurement of the chest and then comparing it to one side of the back. So he does appear to have a regular AP diameter of 1 to 2. Next, I'm going to check for symmetric expansion. I'm going to find the bottom of the scapula, which is at the 7th. I'm going to pinch a small area of skin together at T10. And I'm going to have you take a nice deep breath in. Okay. So the expansion was symmetrical. It didn't expand more on one side or the other. Next, checking for tactile firmness. I'm going to put my hands on your back. I want you to say 99.
99,
Again?
99, 99, 99.
The vibrations did diminish as I was moving down the back, which is a normal finding. And again, I didn't feel any crepitus under the skin. Mapping out my lung field, it would start at C7, which is here. I'll go all the way down to T10, which I found using the bottom of the scapula, which is at 7. Okay, so I'll begin by percussing the lung field. Let me know if you feel any tenderness or anything. And when doing this, I'm making sure to avoid the spine and the scapula. Okay, from what I heard, upon percussion, the sounds were resonant. There was, again, no dullness where there shouldn't be. And I will auscultate the same lung field using the diaphragm of my stethoscope. Okay, and like with the anterior chest, I want you to take a deep breath every time you feel this touch your skin. You okay?
Mm-hmm.
Okay. All right, you can put down your shirt. Okay, so all the lung sounds were clear. Again, I didn't hear any adventitious sounds, wheezing or ronca. Now I'm going to have Garrett lay down. Lay down flat first. I'm going to check for jugular vein distension real quick in the neck area. Okay, and then you can sit up kind of at a 45-degree angle. Not too far. Your head back. Okay, I don't see any jugular vein distension. So now I'll move on to the abdomen. Scoop down a little bit. Okay, I'm gonna pull up your shirt. Okay. So the skin on the abdomen appears to match the rest of the body. It's the color is appropriate for ethnicity. It doesn't appear to have any lesions. The hair is distributed evenly, and there doesn't appear to be any excess. The temperature is warm, and the skin is dry. Noting I'm gonna have you lay a little more flat, just so I can see the actual contour of the stomach. Looking at the contour, it does appear to be slightly rounded, but not that I would consider like distended. There isn't any visible masses, no vein distension that I can see in the abdominal area. The umbilicus is midline, and everything appears to be symmetrical. So to start, I'm going to move the camera a little closer so you can see what I'm doing. Okay, so I would start by, are you having any pain or tenderness in any areas?
Nope.
Nothing? Okay. So I'd start by oscillating the 4 quadrants of the abdomen before percussion or palpation, so I don't disturb any of the movement or anything. And I'll do that with the diaphragm of my stethoscope. And I'm going to listen in about 8 places, 2 places per quadrant, starting in the right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. Okay, the bowel sounds were active without being overactive. They were present in all 4 quadrants. Did you just eat recently?
Mm-hmm.
Okay. Then next, you said you weren't having pain at all?
Nope.
I would percuss in those same areas, starting in the right lower quadrant. If the patient stated he was having pain, I would do that area last. Okay. So the sounds were tympanic. I did hear slight dullness over the area where the bottom of the liver is. What I did forget to do is auscultate the abdominal arteries. You find the arteries, and again I'll use the bell of my stethoscope. You find the arteries by forming a W with your hand and placing it on the umbilicus. The middle finger would be the aorta, and then these 2 fingers are the renal arteries. And I'm listening for bruits. And then I'll, using 2 fingers, I'll listen to the iliac and femoral. Okay. Okay, so I didn't hear any bruits. A normal finding would to be really not hear anything at all, which is what I heard. Next, I'll do light palpation just to feel for any lumps or masses that might be like right under the skin. And I'll start in the right lower quadrant. Let me know if you feel any pain. Right upper quadrant. Left upper quadrant. And left lower quadrant. Any pain?
Nope.
Okay. And then I would perform deep palpation, which is getting more into feeling if there's any problems with the organs, like any swelling or anything. This might be a little uncomfortable, so just let me know if it hurts at all. And again, I'm starting in the right lower quadrant. Right upper quadrant. Any pain?
Nope.
Nothing? Is it uncomfortable at all?
A little bit.
Okay. Let me know if it gets too bad. Left upper quadrant. And finally left lower quadrant. Okay, so I didn't feel any hard masses, nothing like that. The abdomen, the organs in there should feel squishy, which is what they felt like. Move the camera back. Okay, you can sit up on the side of the bed. So just asking some subjective information for the patient in regards to the abdominal assessment. Do you have any problems with bowel movements?
No.
Would you say they were regular?
Yep.
When was your last bowel movement?
This morning.
This morning. Okay. And was it formed or was it like liquidy at all?
It was normal.
Formed?
Yep.
Okay. And did you notice any blood or mucus?
No.
Nothing. Do you have any problems with urination?
No.
You don't experience any urinary frequency,
No.
pain, burning, nothing like that? And do you see any blood or mucus in your urine? No? Okay. And then have you ever had any abdominal surgeries or anything?
No.
Okay. And I didn't feel any abnormalities, which might, I might be able to palpate in the abdomen, such as scar tissue, or obviously we'll probably be able to see it. And do you have any, how's your diet?
Good.
Do you get enough vegetables and
Yep.
fruits during the day?
Yep.
Okay. And obviously fiber and all that.
Yep.
Okay. What about self-care? Do you get physicals?
Yep.
Regularly? And do they perform testicular exams?
Yep.
Okay, and do you ever perform any self-testicular exams?
Yep.
Okay. And then do you have any problems with or any problems with like reproductive system? Anything you're worried about?
No.
Nothing there. Okay. And now I'd move on to the extremities, starting with the upper extremities. Again, the skin on the upper extremities is appropriate for ethnicity. I don't see any lesions. I don't see any masses. The hair is evenly distributed along the arms. I don't see any suspicious moles or anything. No lesions up there. And the muscles on both arms appear symmetrical. The temperature warm and the skin is dry. Do you have any concerns with any like arm strength, leg strength? Have you ever broken any bones?
No.
Nothing? No surgeries on your arms or legs?
No.
Okay. Next, checking for edema over bony prominences like the elbow, shoulder, wrist. Okay. There doesn't appear to be any edema. If there was, I would further assess by documenting the how much pitting there was, or how swollen the limbs appeared. Next, I'll check capillary refill. Hold out your hands like this. Okay, capillary refill on both hands was less than 3 seconds. And now I'll check for the brachial pulse. which is 2 plus equal bilaterally. Radial pulse, 2 plus equal bilaterally. I'm going to have you grip both of my fingers. Okay, squeeze. Okay. Okay, the strength was equal bilaterally. Hold up your hands like this. Resist my push. Resist my pull. Okay. Again, the strength was equal bilaterally. We can perform some range of motion. Can you hold your hands out like this? Up and down. Circles. Move them in and out like this. Can you flex and extend? Any pain or anything?
Nope.
Can you put your arms behind your back and touch the bottom of your scapula? Okay, no pain?
Nope.
Put your arms up and to the side and arm circles. No pain?
Nope.
Okay, and you don't feel any limitations or anything?
Nope.
And there were no visible limitations that I could see. Next, I'm going to have you lay back down again, sorry. To assess the lower extremities. The hair on the legs is evenly distributed. The color is appropriate for ethnicity and matches the rest of the body. Again, no lesions that I can see. The temperature warm and the skin is dry. In a normal assessment, I would most likely palpate the femoral artery, but for the sake of this video, I will not be palpating that artery. Checking for edema, the knees, over the ankles and feet. Okay, there is no edema that I can see. I'll check capillary refill on the toes, on both feet. Okay, capillary refill on both feet was less than 3 seconds. I'm going to have you bend your knee just a little bit more. I'm going to palpate the popliteal artery. Okay, his were 2 plus equal bilaterally. Typically, you may not be able to even palpate that pulse because it's so deep, but just his was very strong. So in this case, I did feel it. Next, I'll do the posterior tibial pulses. There are 2 plus equal bilaterally, and then the dorsalis pedis, which are 2 plus equal bilaterally. Some strength tests. Can you lift? This is a straight leg raise. So raise your right leg. Okay, you put down, and your left leg. Did you feel any pain at all?
No.
And I didn't notice any limitations with movement. He was able to raise them to a symmetrical height. Next, I'm working on the feet. I'm going to have you resist my push, or my pull, resist my push. Okay, the strength again was equal bilaterally. And now I'm going to test sharp, dull perception on the feet. Just using a pencil which has a sharp side and the eraser is the dull side. I want you to close your eyes and tell me which sensation you feel.
Sure. 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 Dull. 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 Dull.
Okay. And you open your eyes now. And next I'll check for the Babinski reflex. This might be a little uncomfortable, but just be over soon. Did that hurt at all, or was it Are you ticklish?
You-
Might use the end of my pen light instead. Try not to move your foot like away. Okay. Okay. He had normal plantar flexion. If the Babinski reflex was positive, he would his toes would be splayed out rather than bent over. Okay. Flexed over. And finally, I'm going to do a couple more tests for you. I'll have you stand up. First, I'm going to check, do the Romberg test. Okay, so stand with your feet together. Close your eyes. Okay, the patient did not sway at all, which is a normal finding. Put your hands out to your side, touch your right pointer finger to your nose, and back out, left pointer finger to your nose. Okay, he was able to touch his nose on the first try with each finger. He has good sense of placement. I want you to take, just walk and then come back to me. Okay, his gait was steady, the posture remained erect. He didn't use any objects to help hold him up or anything like that. And then finally, I'm going to have him do the heel to shin test. So I want you to take your left heel and run it down your right shin. Okay, and do the same with the other leg. All right. So he was able to run both heels down each shin without any issues. So you sit down. So after the head to toe assessment, I would make sure the patient was comfortable, had everything he needs, including call light, if we were in that type of healthcare setting. And I would make sure to document all of my findings and provide them into the patient's chart. Thank you.